To solve your knee pain, you need knowledge and understanding. That's the very first step you need. And I don't mean some fluffy, vague statements like build your awareness, but concrete. What do you need to learn to get rid of the pain? And there are two types of this kind of understanding. One is through your upper brain, cortical, logical thinking. You can describe it with words, with symbols, analytical thinking, basically logic, right? That's one way of understanding, but that's not enough. You also have to have the mid and lower brain understanding. This is more of like in the body experience, understanding that manifests itself when you are performing automatic actions. When you're slipping on this banana skin, you don't need analytical thinking. You need quick brain to respond properly to suddenly changing environment. This last week, I had a patient who came and he told me that he noticed something funny. A few years ago, he injured his meniscus by walking on sand. Then he had a surgery. After surgery, he had a relapse, again triggered by walking on sand. Eventually, the knee got better, pretty much completely better, until this previous weekend when he went fishing and he was walking on the beach again. And walking on sand tweaked his knee once again. So obviously, we need to solve the problem of walking on sand. And first level of this, I have to have some kind of hypothesis, like why? What's happening? What is it that he does on sand that he doesn't do during regular walking? So this will be this upper brain, logical, having hypothesis. And then when I have a hypothesis, I can help him create treatments, create movement exercises that will retrain his lower centers of the nervous system. Otherwise, it is haphazard. Sometimes I even reverse the process. As Charlie Munger says, reverse, always reverse. In other words, instead of thinking how to get rid of pain, can I create a mental model that will, if I wanted to get pain like that, if I wanted to hurt my medial meniscus, what would I need to do? What specifically? How would I need to walk on sand? What pattern of movement could create strain on those tissues? And we know torquing and gapping of the knee, opening one side of the knee, is a recipe for medial meniscus. If I have the mental model and then see it in a client, how they move, we know we're onto something. In case of that client, I had him walk wearing socks on the regular wood floor of our office. And there it was. I could see his heel pivoting every time he put his weight on the leg. As he was loading the leg, his heel twisted a little bit inward. Every time the heel went whoop, in, which is rotation of his lower leg. And therefore the torquing that leads to, when you're walking, you're putting weight on the leg and then you're pushing off that leg. And if that leg is torquing, you will start to create gapping in the knee. I knew we are onto something. And I demonstrate here what he did, that rapid movement of the heel inward, which misaligns the knee and puts the strain on the inside structures, including the medial meniscus. If you want to test yourself, what you could do is record a video of yourself walking away from the camera and toward the camera, zooming in or having a good view of your heel, because sometimes that pattern is very subtle in terms of addressing. So coming with hypothesis is one thing, but then what will you do about this if you discover that your heel does a similar thing to what my client's pattern. Number one is I check mobility of the ankle. If the dorsi and plantar flexion, and especially dorsiflexion of the foot, meaning bringing the toenails up toward your shin movement, flexing your ankle, if it's full, because limitation of this movement may mean that kind of rotation in order to avoid deeper bending in the ankle. For that, if there is a limitation of ankle movement, I focus with general range of motion of the ankle, a glide of the talar bone underneath the tunnel of the two lower leg bones. Of course, logical place to address will be flexibility of your calves and the Achilles tendon. So maybe some lengthening of your heel cord and the back of the calves could be beneficial. Make sure that when you are doing the lengthening of your calves, you keep your foot pointed straight forward rather than with a turnout. You can solve the problem by yourself or find people or tools that will help you get better results or faster results. But no matter what you choose, whether you choose to do it by yourself or with a team of people, you need to get crystal clear or close to crystal clear about your condition. And that's exactly why I created the knee assessment tool. It's a 5-minute quiz followed by a few days of essential training. It's free, and you can find it in the descriptions below. Also, please check the video that I recorded devoted to my interpretations of all the 23 answers of the knee assessment quiz. I go over these questions one by one, showing you examples of how I interpret the answers. If you haven't done the quiz yet, start there. It will take you only 5 minutes, and then join me for the video devoted to the answers to all of these 23 questions. It will be much more meaningful than watching the video without first doing the quiz. I hope you found this useful, and if so, please share with others, please like it, and subscribe to the channel. I will see you in the next video.